right, so you got your box of HCG. Now you need to know how to mix, and now you need to know how to inject. All right, so what are you gonna need? First off, you'll need your box, and inside your box you'll have instructions in there. And then you'll also have your powdered HCG. This is 10,000 IUs. And then you're gonna want 10 ml of bacteriostatic water. These come in the box. Hopefully it focuses, it's 10 ml. And then you'll wanna use a 10 cc syringe. And for a needle, you can almost use any needle, but I would say 18 to 23. For this one, I will be using a 21. I also have an alcohol and a 1 ml insulin syringe here. This is a 30 gauge 5/16. We'll be using that later. Now, you're also going to see this little sticker here. And on this sticker, it basically reminds you of the date that you mix this. Okay, on here it says 60 days. So after you mix this, you're gonna wanna refrigerate it. Keep it out of the light. And after 60 days, this says, hey, you should throw it out. Now, depending on where you're at and what you've talked about with your doctor or your pharmacist, some people say as little as 28 days. And I know what you're gonna say. Well, Dr. Mo, I've known people to use it 90, 120 days. I get it. I gotta follow the rules as a doctor. I'm not trying to get malpractice, so listen to your doctor. Hands, but I'm throwing on my gloves here. All right, so you're going to connect the 10 ml and the 21 gauge. Okay, trash. Now these are sterile because the top hasn't been popped yet. After these have been popped, every time you want to draw up, you're gonna alcohol it, all right? But look, pop that off, pop that off. Now first, I'm going to draw the 10 ml up into the syringe. Because it's vacuum sealed, you may have to put some air in your syringe first. So you do a little like this, and you're gonna draw up all 10 mLs of bacteriostatic water. Okay, once you have all 10 mLs, you're just gonna go ahead and do the opposite. You're gonna put the 10 mLs into your HCG. And it's usually vacuum sealed, so it will, it should suction it in. Just slowly inject, and you may have to allow some air into your syringe. That's why you can turn it up down like this. You're allowing the air to switch with the bacteriostatic water. All right, now it's mixed. Let it sit for a little bit. You'll recap your needle. This is the official way to do it, and a lot of people don't do it this way. And then you'll go ahead and sharp this. You're done with that. Now we're gonna move on to the injection. Like I said, normally you would alcohol this top, but this top does not need to be alcoholed after you have just mixed it. All right, now that we're on to injecting, we need to understand we just put 10 mLs of water in with 10,000 IUs. So that means for every 1 ml that you draw up, you will get 1,000 IUs of the HCG. So if I have a 1 ml syringe and I draw it all the way up, I'll get 1,000, okay? Most often guys are doing 250 IUs twice, 3 times a week, sometimes more or less, depending if you're using it for monotherapy or if you're using it to keep your testicular function going while using TRT. The important thing to remember is do not listen to this. This says 100 IUs. This is not made for HCG. This is made for insulin. Very common mistake, okay? So that means if we want to draw up 250 IUs, I'm going to take this 1 ml syringe and draw up 25%. Or on this one, it will be to the 25 unit mark, okay? And again, I like holding it this way to brace my hand, draw up. So you can see, and it takes a while because this is a very small needle, right? So I'm gonna go right between the 2 and the 5. Okay, so now I have 250 IUs of HCG in here. All right, we're gonna do the injection into the belly fat. So you're gonna get an alcohol pad, you'll raise your skin just a little bit, and you're gonna alcohol from the middle and go out. Now, with subcutaneous injections, you really wanna come at 45 degrees. It doesn't make a world of difference. You're most likely not going to get in the muscle, and if you do, I argue it doesn't really matter. But you'll see, okay, I had recapped the needle. I didn't show you that. I'm going to take a little bit of pinch of my belly fat, and I'm going to try and come in at 45 degrees, okay? So boom, 45 degrees, and then slowly administer everything. And then you want to draw out in the same way you came in. It's going to limit the amount of bleeding or any bruising, okay? And then you'll recap, okay? Recap, sharps. Done.